We have some special guest speakers today from India, and I am very excited for their participation. We have Vidya Shankar and Dr. Sunil Raina. Vidya is representing Project Step 1, an all-volunteer doctor organization in India. And Dr. Sunil works as a medical doctor in public health in India. So thank you so much. We also have Yaneer Bar-Yam, president of New England Complex Systems Institute, who is our founder of endcoronavirus.org. We've been here now for over a year, fighting coronavirus, determined to get to zero. And I will turn it over to Yaneer to say hello. And then we will turn it over to our special guest speakers. So Yaneer, good morning, good evening to you, if you would like to start. Thank you.
Thank you, Katie, very much. I would like to say just a few words about the challenges that we're facing in India. The situation, as we've heard, is terribly severe. The conditions, the loss of life, the disease, the inability to help people that are suffering is terribly terrible to learn about, and really we would like to be of help to stop what is happening there now. Now, there are really two very different parts of what should be done. The first of them is to prevent cases from happening. Because if we prevent cases from happening, then we don't have these consequences. The second, of course, is to respond to the current case, an individual who is sick, to help to heal them, to cure them, to enable them to return to the life as quickly and as well as we can. Now, these two different tasks or two different opportunities involve very different kinds of actions. And so we actually have two different speakers who can address them and help us understand in what ways other people who are in India or outside India might be able to contribute to the efforts that are underway to address what is going on there now. In particular, we have Dr. Sunil Raina, who has for a long time now during this pandemic been advocating for actions that would have prevented what is happening, that could have made the situation simply not take place. And I would like him to devote his time to explaining what could be done, and also to help us understand what we can do today to try to make sure that in the next weeks that the situation is dramatically improved. And then we have Vidya, who is a key individual involved in Project Step 1, which involves volunteers who are engaged in telemedicine, who can help us understand situations that can be done, things that can be done now to further to address the situation in terms of the current conditions with the people who are currently sick and require as much help as we can provide. Dr. Raina, please, why don't you begin your presentation? If either of you would like to use slides or presentation materials, I'm sure we will be able to help you do that.
Thanks, Yaneer, and I am happy to share my opinions about what's happening in India at this point in time and probably what exactly we can do to help the situation. Before we go into the details of that, I would also like to tell the people who are sitting in this meeting that India is not doing well, but so are the other countries. None of the countries across the world is doing well at this point in time, as far as pandemic is concerned. All of us are almost in the same boat, barring a few very small nations, but rest of us are almost on the same boat, in the same boat. And why I am saying this is because of late I have been witness to comments in the lay press as well as in scientific journals, which have been critical of India, critical to the level that they have been very detrimental and not in a good taste about India's efforts to tackle this pandemic. I'm sure, as I said at the outset, we are not doing well, but so are not the most of the countries. And why we didn't do well, we will delve into that, of course, and we will also work out how exactly we will reach out to the situation that we reached out in the month of February this year only, when our numbers were very low at that point in time. So I broadly categorize what went wrong or why did we hit the numbers that we are hitting at this point in time. I will broadly talk of 3 or 4 points which I found very interesting or which I found we should be shared with people across the world. Now, one, as I keep saying, that we opened too early, probably. So when we were hitting the numbers of around 11,000 in the month of February, we started celebrating, and the fault lay with everybody. It was the individuals who started celebrating, the institutions started celebrating, the communities started celebrating, so did the governments, the state as well as the central. So everybody was in a celebratory mode and opened up too early for everybody's liking or for the liking of the scientific community. Now, what did that do? What is the most important or the vital step that did was that we put into the system a whole lot of young population, which were held back by the lockdown, which we had imposed for a long period of time, or the restrictions which were extended for a long period of time. So those young people got into the system, the children got into the schools, the students got into the universities and colleges. And as we are all aware that this is a bunch of people who are high risk taking, they will always want to go out and mingle with people. So they were the people who started going out, throwing caution to the winds, and buoyed by the fact that we have won. We were in the celebratory mode, so that got accentuated. Those all celebrations got accentuated. So that's one part of it which went against us. The second, which I thought went against us, was that by the end of 2020, the shift of management of pandemic, the focus of shift of management of pandemic shifted from mostly central government to state governments. So you need to be slightly aware of the way it works in India. India follows mostly a federal system of federal structure. So India has the central government and the state governments, not necessarily ruled by the same political party. So we have the states and we have the central government. The states, as per the provisions of the constitution, states are privy to the health. Health is a state subject. Health is not a central government subject. So by the end of 2020, what happened was most of the management shifted from central government to the states. So states started taking responsibility of managing the pandemic, or primarily, again, because of the fact that we started thinking that the numbers were falling down. Now, if you look at states across the country, states don't have the same scientific infrastructure as is available with the central government. So that's where the states across the country lack. So they don't have the same facilities that are available at the central government. They don't have an NCDC or the National Center for Disease Control under their ambit. They don't have a National Institute of Health and Family Welfare. They don't have a National Health System Resource Center, which will tell them how exactly to develop policies. So they don't have many options with regard to their scientific infrastructure. But once the shift was to them, they had to take the responsibility. And unfortunately, because of the fact that they didn't have the scientific infrastructure, they couldn't develop a sustainable, data-driven scientific strategy, which would have carried the benefits that we had in the last part of the 2020 for a longer period of time. So states taking up the initiative from the central government, but failing to deliver at the same level wherein the central government had been able to deliver in year 2020. So that's primarily how exactly things went in a way we had not anticipated. This is how these 3 or 4 things, that is how I see that we went into a situation where we are at this point in time. Now, how exactly do we need to sort it out? As Professor Yaneer rightly pointed out, there are 2 situations at hand at this point in time. One is, how do we deal with the numbers that we are throwing at this point in time? So we have around 4,12,000 or 14,000 reporting today. So how do we deal with the numbers? And second is, how do we deal with the prevention part of it? Or how exactly do we cut down the transmission? Prevention, the best way of managing the best way of managing the best way of probably being able to cut down this pandemic or reduce the numbers is preventing transmission. So that is the second part of it. So what I feel is that we need to go together as far as our approach at this point in time is concerned. Because why I'm saying that we need to go together at this point in time is because an inevitability about the third wave coming up has set in India at this point in time. People are feeling that we are inevitable to enter into third wave. We are inevitable to enter into the fourth wave. So that inevitability of third and the fourth wave coming is again not good for this country. We need to tell people that if we deal with this pandemic at this point in time, deal scientifically, we will be able to get down to zero and we will be able to take care of the third and the fourth wave. That is something that is needed at this point in time. And that's why I say both these things should go in hand. At one point in time, we need to take care of the patients at this point in time, as well as be able to cut down the transmission. So as far as the first part is concerned, how do we tackle the patients, that is the surge of patients that has come up in this country over some 1 or 2 months, is that there are some excellent models at this point in time which we need to take account of. So if you look at the country at this point in time, there are some states which are doing not well, and there are certain states in this country which are doing exceptionally well even at this point in time. Some small states in Northeast are still doing well as compared to most of the states. Now, if we compare, for example, an Uttar Pradesh with the Maharashtra at this point in time, Maharashtra is throwing up huge numbers, but Uttar Pradesh is still not showing up numbers at the same level that it is expected to, given the population that it has. Or, for example, Bihar, again, the size of Maharashtra, but not showing the same numbers that Maharashtra has been showing for the last 2 months. So this is something that there is difference, discrepancy, or diversity as far as this country is concerned, as far as throwing up numbers is concerned. Again, accepting the fact that the numbers may not be truly reflective of what exactly is happening on the ground, but numbers are still the numbers. Maharashtra is throwing up higher numbers. UP, Bihar is throwing up lesser numbers. Or a small state in the northwest of India, Punjab is throwing up higher numbers as compared to, say, for example, Himachal Pradesh, or for example, JNK. Again, similar populations or similar type of people, not much of diversity, but throwing up different numbers. So what should we do? What should we be doing at this point in time to as far as these states are concerned, which are throwing up high numbers? So the best way is to follow what Maharashtra is doing at this point in time. So what Maharashtra is doing is, Maharashtra is building up war rooms at even the most basic levels. So Maharashtra, what did they do was, even at the level of wards, local, very small part of the city, a very small part of the state, which represents very small numbers. So they have developed these war rooms at the level of these wards, and these war rooms are all solution facilities to everything that happens with regard to patient care. Whether you want to see where exactly your patient has to be admitted, where the bed will be available, how many beds are available with this particular in the vicinity of that particular patient, how oxygen can be delivered to this particular place, how medicines can be delivered to this particular place, as also the fact that what is available in terms of medical infrastructure across the city at that point in time. So these war rooms function as the single stop solution for all problems with regard to healthcare in Maharashtra at this point in time. And probably that's why they are showing lesser numbers, or they are showing less case fatality as compared to the country as a whole. So the number of people dying in Maharashtra is very small as compared to the number of people dying in Delhi. The numbers are hugely different, significant difference as far as deaths in Maharashtra are compared to, for example, in Delhi. That war room strategy is something that needs to be built across the country at this point in time. But at the same point in time, I find that these war rooms need to have an integration with the state command as with the national command. And developing a national command will be the key. The national command needs to have experts who are in the realm of pandemic management. So they should be the ones taking care of this central command or the national command at this point in time. And this national command should be on a weekly basis talk with the state command, and state command should be the one directing these war rooms of what exactly to do and how exactly to do that. Because as I see, the war rooms are not thinking scientific intellectual people of the same extent that experts who are dealing with pandemics are. So maybe having a better idea of how exactly this pandemic will pan out at the local level and getting a first-hand experience will be helpful to them. So that's something that we can debate on later in the part of the discussion as well. The second part is, as I've always been keeping, restrictions is the key, and we need to have extensive restrictions for a period of 4 to 5 weeks. And these restrictions need to be debated and discussed with every stakeholder in the country. So everybody who is there in the country needs to be a part of these restrictions. They need to voluntarily submit to these restrictions. As I keep saying, 2020 was successful because whatever guidelines Government of India made, people submitted to them voluntarily. So if we are imposing restrictions at this point in time and asking people to submit to them voluntarily, we have a more successful program at hand. If we see that people are not willing to follow the restrictions, we will again have problems. So it's important that we involve all the stakeholders, whether it's the individuals, the institutions, the community, everybody needs to be taken on board to use these restrictions. And then of course, we all know that the lockdowns or the restrictions will end someday, but we need to open carefully. This is something that we made a mistake in the first place. So we need to open carefully, and there is no better way than to open through that green zone strategy. So these are some things that need to be done. And if we are able to do it now, I'm sure we will be able to win this battle. Otherwise, it's going to be a long haul for all of us. Thank you.
Thank you very much. And maybe a quick review. We need to make sure that the overall strategy of addressing the transmission is in place. And we need to have what Sunil described as war rooms locally that are able to galvanize whatever medical attention is needed, where it's needed, resources that are needed, that can coordinate the delivery of services and care in the locations where it's needed. Have I summarized correctly?
Absolutely. It's important that we have these war rooms in place because the success of the pandemic will be seen by the fact that we are able to take care of the patients. That is something that is inevitable at this point in time. If we are successful with the patients, people will respond to us better. So that's something that has to be there.
And there was one thing that was implicit in what you said, and maybe I will emphasize that the disease, even as bad as we are aware of it, is very heterogeneous from state to state. And what that means is that if the states that have low numbers of cases are able to be controlling the cases there, they can also then help other states where the cases are high in the provision of care and in the dealing with the situation there.
Absolutely true. This is something that I was talking about yesterday as well on some channel. If you look at Uttar Pradesh has numbers of around 20 crore, and it's a huge state in terms of its area, in terms of its population. But if you look at the number of cases that are coming from Uttar Pradesh, they are coming from certain pockets of Uttar Pradesh only, not entire Uttar Pradesh is involved. So most of the facilities can be diverted to these areas which are showing up higher numbers. So resources are there, limited resources, but divert them to where they are needed the most. It may not be possible to do so in Delhi because Delhi is a small area and a huge number of people in a small area. It may not be able to do so in Delhi, but it may be possible to do in UP, in Bihar, huge states, huge diversity, lesser number of cases in small pockets, or even Karnataka, where from Vidya comes. Karnataka is not entirely throwing up huge numbers. Bangalore is the epicenter of the pandemic at this point in time. So maybe, and Karnataka has huge advantages. Karnataka has more than 50 medical schools, if I'm correct. It has a medical school in almost every district of of it. So a tertiary care setup of high grade, high quality in almost every district of Karnataka. In fact, there may be more than one or two medical schools in every district. So they can be used, they can be pitched in to take care of the situation or take care of the epicenters that are there in Karnataka, for example.
Okay. Thank you very much. Let me move to Vidya to talk about Project Step 1 and the opportunities that they are focused on. Please.
Namaste from India. My name is Vidya Shankar. I am a full-time volunteer for a project Step 1, which Mr. Raghavendra, known as RAX, has founded it in last March 2020. And I joined this particular drive from the day number 1, keeping in view that, we need to reach more and more citizens who are affected with COVID-19, which was very new and clueless, how basically that was behaving. So Project Step 1 is basically a non-profit collective of technology and doctors on a mission to augment government resources with people, technology, and processes to effectively fight COVID. We totally believe that to contain citizens back at their home during the first wave, the technology is the only process which we can basically adopt to connect between the right medical fraternity and the citizens for their all questions which was rising in their minds, and they were in a helpless situation to reach out the medical fraternity in the gloomy days. We started working with every state government and moved from starting from Karnataka, building a right technology and processes completely driven by the people. It divided into medical fraternity volunteers, citizen volunteers, and as well as functional volunteers, we call them as. And we have a large network of around 7,000 doctors, around 1,000 nurses, more than 2,000 medical students, 1,000 counselors who are helping us to heal the mental wellness, especially in the North Indian states. And we have 3,000 non-medical volunteers working as part of the processes. So what is that? Basically, we created an impact doing all these things. Even now, today, I think our team has reached out to around 60,000 citizens, asking their well-being, about their family members, how are they, what are the drugs they are taking, what are the precautions they need to take. And around 4 lakh patients we are monitoring as a home isolation product. Until now, we have at least reached 3 million positive cases, but lives touched till date through the tele-triaging, completely driven by citizen and medical fraternity. And the overview, if I have to give now, is 3.5 lakh citizens testing positive every day. That is in my state where I'm living in Karnataka. For every 100, I think we are getting around 55 to 60 people positive cases, especially between the age group of 25 to 40 or 45. And hospital beds and oxygen are the scarce right now in many cities. As Dr. Raina was very clearly mentioning, Bangalore alone, that is capital city of Karnataka, Bangalore alone throwing up around 22 to 23,000 cases every day. That is 50% of the whole Karnataka. Providing early care at home is what felt we key to avoid morbidity and mortality. And we started basically treating patients in home isolation till they are able to find a suitable hospital bed. Doctors to recommend the home care treatment plan for patients, as it was mentioned by every state government, as we are augmented with state governments. High-risk patients can be recommended for hospitalization once a doctor screens the patient through a teletriaging. And if high-risk patients need an ambulance immediately, they can be recommended as emergency. An ambulance arrives and pick up the patient and take them to the relevant hospitals. The process flow, what we thought is the right one, of course, with the guidance of Dr. Raina and other such eminent doctors. COVID patients data we received from state government and government authorities or patients call it as helplines, either with the state government or the step one. And step one volunteers basically screen the patients to find relevant cases to be sent to the doctors. That is, we are utilizing the help of medics, nurses, citizens, volunteers before the cases gets into the loop of doctors. And step one doctors call the patients to check their clinical conditions, to counsel them in every week, like, between the first day to third day, then 4th to 7th day and 7th to 10th day when they are in home isolation. And home management protocol is initiated for patients according to the government regulations and protocols. Information about patients' condition is passed on to government authorities for further action. We have built the right APIs basically where government authorities can draw those vital data from step one which we have gathered. And to say what is that we require now, we need more and more doctors basically to contribute in teletriaging and reaching out to every citizen. We have even planned basically to reach out every citizen across India to ask their well-beingness and how they have to take the precautions, even thinking of getting infected. And doctor volunteers to recommend the home care treatment plan. We need more and more oxygen concentrators and oxygen cylinders. Unfortunately, today we have received in different cities and ICU ventilators and beds in time statistics, which is more and more vital. I think Dr. Raina always very, very even Yaneer sir very clearly mentions data is vital. We have to fight COVID on data. That is what step one is basically enabling to medical fraternity and the government. And new verification centers, this is what I basically thought of in terms of war rooms, which Dr. Raina mentioned very, very clearly. We have districts, midtowns, hamlets, villages, and village panchayats, and we have leaders in all the hierarchy from basic hamlet to the central government administrative level. So if you put the right verification centers or the war rooms, it will filter out all the probabilities of getting infected or spreading out this very, very gloomy virus. And war rooms in every place with responsive helplines. Vaccination, which has become one of the dearer thing once it has been launched, as it was given to medical fraternity in the first line. We know that the vital data again says the mortality in medical fraternity has come down to 10 to 12% as we see compared to the first wave, because every medical fraternity is being vaccinated. So the awareness towards getting vaccinated is a vital phenomena or element what we think. This is about what projects step one is been trying to do. And recently we are basically funded, and recently we had a word with many of the manufacturers across the globe, and probably we are receiving oxygen concentrators and cylinders and other vital important medical equipments which can basically save lives of COVID affected citizens, sir. Thank you.
Thank you so much, Vidya. That was really informative. Thanks. All right, well, we have collected many questions from our active and engaged audience, which I am super appreciative of.
Let me, Katie, let me actually take prerogative, and I would like, Shruti can either say it herself, or I would like to say one of her comments here for everyone to hear. Shruti, would you like to unmute?
Well, hi.
Yes, Professor. Hello.
Yeah, Shruti is.
Hi.
Yeah.
Yeah.
Sorry, there are two Shrutis. I'm talking about Shruti from Taiwan, who said Shruti Chow.
Yeah, Yeah, I posted, I think I
Could you
posted.
read, could you just read the point about the voice from India to the whole world is the cry for oxygen? Could you say that very clearly, please? Yeah.
Yeah, under such a crisis, we know that doctors and nurses are doing everything best to save lives, and they actually put themselves in danger too. So anything they say would be very powerful. However, it's very important that doctors and nurses use this opportunity when the whole world is watching, use this opportunity to deliver the most important message. It's not only to the world, but also to the government. And it's important that if the spread is not stopped, then no matter how many oxygen bottles you have, it won't be enough.
In other words, we have to
And
stop the spread.
actually,
I think she's losing her connection. I think that the point is the following. Yeah. That, go ahead.
itself is of
Shruti, we can't hear you, so
We
I'll
can't
have
hear you. Let me just summarize. Let me summarize. The priority is to stop the transmission and to help the patients in that order.
Oh,
We lost her.
bad
Okay.
connection. Okay.
Now, Katie, would you go to other questions, please?
Yeah, so we got a lot of questions. So we will do the best we can to get to all of them. So thank you everyone for your submissions. I'm gonna put the all of the speakers here on the screen. Please step up and answer the questions if you feel you have the answer to these questions. All right, let's start with question 1 from Harsh Vadam. He would like to comment on, do you recommend, this is about vaccines, do you recommend increasing first dose coverage while deferring second dose interval to 12 weeks?
Sunil, do you want to address that?
Look, when these vaccines were developed, which were in use in India, they followed a particular policy. And the policy was that there should be a gap of 4 to 6 weeks between first and the second dose. But what general epidemiology or general immunology says, if we are creating a bigger gap, maybe of around 8 weeks to 12 weeks, it doesn't make much of a difference. So having a gap of 8 to 12 weeks between the first and the second dose is not going to make much of a difference, and it will be helpful as well. But the key for us to understand, as far as I understand vaccination is not just about immunizing individuals. It's also a managerial tool to create a large pool of people who are immune to the disease. And if by having a larger gap, if we are increasing the gap from 4 to 12 weeks or 4 to 8 weeks, we are able to immunize a lot of people, more number of people. By just creating that gap, I would say it's an advantageous thing to go with. This is something that we should go with because it's not going to compromise immunity.
Again, vaccines are a tool, but the time frame is long enough that we need to start with other things, and particularly stopping transmission will prevent the disease much faster. So again, we need to use it as much as possible, but we need to focus on what can be done in a very short time frame, because within days, transmission can be stopped if strong action to prevent transmission is taken. Let's go to the next question.
Thank you, Dr. Sunil and Yaneer. All right. Question 2 from Sangeeta Pradhant. In the US, we've been donating to the cause in India, and are there any specific charities you would recommend to ensure that the money actually goes where it needs to? If you do have some ideas, maybe it'd be helpful to put those in the chat.
Well, so to be not selfish, like, of course, Project Step 1 receives funds. We are figuring out how to receive funds from overseas because we have some regulations from the finance ministry. However, in this pandemic, we have a lot of other charitable association, including Prime Minister's Fund, where they can receive funds from any part of the globe, and it will be like, definitely utilized very judiciously to the sake of healing the citizens. And Project Step 1 is more than happy to receive such funds, and it will be transparent and deploy the right things in right places.
Okay.
All right, thank you. Yeah, so if the other speakers know of reliable charities, please, or please share them in the chat. All right, question 3 from Saruj. How would complexity science help in developing the preventing strategies? Most countries seem to be using faulty statistical models rather than relying more on modeling such as agent-based modeling or network analysis. Yaneer, this sounds like a question for you.
Yeah, so the main thing is the dynamics of the disease is the key here, right? If you have exponential growth, we saw over the last really few weeks how rapidly the cases grew in India. We know that India can reduce the number of cases. It did so before. If India really threw its will into reducing transmission, within several weeks, the cases would be down dramatically from where it is now. And the crisis mode that is present would be stopped, and the opportunity for identifying this, for following a strategy of preventing further cases, in particular getting to elimination, would be possible. It is really a matter of understanding the mechanisms for control of pandemics, and agent-based models, nonlinear dynamics, and other forms of analysis from complex systems will all point in the same direction, that there are two different conditions. One is a condition where we allow the disease to spread in the population, and the other one is the condition where we are determined to stop it. And it's the latter that is the opportunity for preventing the kind of situation that we have today.
Great, thank you so much for that. Raja Gopal really made a good statement here. I'm going to read on behalf of him. Is there a problem in thinking that the onus is only on the common people to act cautious? They definitely should be cautious, but India was indeed aware of a second wave's existence through lessons from other countries in Europe. Shouldn't we be talking about how to make the government and institutions act wisely, keeping a longer term approach in mind? I believe that is what all of the speakers here are saying, is that prevention and being extremely cautious right now with restrictions is paramount.
Let me just check. Sunil, do you want to add something to that?
Probably this is very vital, that we need to realize one basic fact. There is difference between individuals, institutions, and the governments. When governments take up the issues of pandemic, they always think of a basic compromise, because governments also are worried about the pandemic having the lockdowns or restrictions having an impact on the vulnerables that are there in the country. So maybe they always think of those 30-35% people who in India who they think they will suffer from the lockdowns. So they are always in for a compromise. Why I say that the onus should be more on the individuals, but because individuals on themselves can make a movement which will be forcing the governments to go for a restriction, like situation or a lockdown. Government on its own may not at this point in time be thinking of a national lockdown, just because of the fact that they don't want to worry about those 30-35% of vulnerables. That's the problem with this situation at this point in time.
All right, we have a few questions regarding the vaccine from various folks. Sanjeet, asks, is there any data or insight into the effectiveness of the vaccines such as AstraZeneca, Covaxin, and Pfizer against the variants that are currently circulating in India? We've heard some anecdotal reports in the press about fully vaccinated people getting severely ill with COVID in India despite having vaccinations. Another question from Sebastian, just to point out that it's important to make people aware that there's a significant lag time between vaccination and the reduction of cases. And that is not being well communicated around the world. Comments on that?
So the challenge indeed is that there's a time delay after vaccination. There's also a huge time delay in the production of the vaccine to reach enough people to have an impact on the transmission. And finally, indeed, that we do not know yet how well the vaccine will stand in the face of current variants or in the face of variants that are arising over time, especially when there are so many cases where variation is, mutations are ongoing. So the existence of increasingly diverse variants is present in the country, in India, and of course also around the world. Go to the next.
Thank you. All right, we have a question from Blake Elias. Regarding voluntary submission to restrictions, it seems that paying people as an incentive to follow restrictions could work more effectively than just asking them. Moreover, paying that price would be economically worth it. How do we get this to be more part of the conversation?
Sunil, do you want to take that one?
This is very important, and this is something that is a part of this lockdown strategy or the 5-week challenge that I have been advocating. So if you are shutting down, offices, if you are shutting down workplaces, you need to at the same point in time ensure livelihoods. And if you are ensuring livelihoods, you need to build incentives for everybody who's working at that point. Look, it's not the government offices that will suffer because the government will continue to offer salaries to the people who are working in the government setup. But those who work in the private setup or work on a daily wage basis, they need to be incentivized. And most of the governments at this point in time across the country are doing that. Even if the incentives may not be of huge level, the money that is being offered for people to stay at home in lieu of the fact that they will stay at home as incentive may not be huge in terms of money, but they are offering the money at this point in time. So that is something that has to be given. You have to ensure livelihoods to ensure the fact that people stay home.
All right, we have a question from a reporter here that is in the audience. Anjali.
Hi, that's me. Yes. Hello.
Go ahead.
Right. So, hello. Great discussion. I'm from the Economic Times, and I wanted to ask, a couple of things. How do we get involved in, making sure that these, the kind of steps that need to be taken to stop the spread can happen? Because I feel like we've undone a lot of the good work that we did last year, especially with regards to borders and quarantines. They seem to have completely disappeared. At least we had quarantines in place last year for inter-district and interstate travel, and that's just not there anymore. And I don't see how we'll stop the spread without these things coming in. That's it. Yeah, thanks.
Go ahead, Sunil.
I think a few days back, most of the states have started this process of quarantining again. And they have put in place these interstate restrictions and inter-district restrictions. A lot of states have done this. And they have also put in place this quarantining. But there are two things that I would like to address. One is that there's a lot of question on raising the number of tests that we do on a daily basis. There has been a question on that as well. I see it as a combined effort. You raise the test, but you should also have the facility to isolate, and you should also have the facility to quarantine. So unless and until we build in a system of paid quarantine sort of a thing, wherein people who are able to pay money for the fact that they are quarantined in a good facility, and the money that is obtained from that part of facility. So, for example, somebody is paying 5,000 for paid quarantine. That part of money can be used to put into a system which is going to make unpaid quarantine as well workable. So maybe if you're earning around $1 lakh from a paid quarantine, so some part of it, this money should go to unpaid quarantine for those people who are not able to go into quarantine on their own. I give you an example. If somebody who's a daily wage earner or a laborer and he is put into a quarantine, he doesn't have a facility, home-based quarantine, he doesn't have a facility. So what do you create? You create an alternative facility of quarantining him. Now, most of the quarantining facilities are cramped for space because of the fact that large number of people are put into these, which are non-paid or unpaid quarantines. So what I would say is that there has to be an equitable distribution of quarantining, and some money from paid quarantine should go to the non-paid quarantine. So all hotels who are sitting idle at this point in time should volunteer that they will be offering paid quarantine at some subsidized rates, and some part of that money will go to unpaid charitable quarantine, which can be held at the same point in time. So something like that needs to be worked out.
Okay.
Right. Yeah.
Let me add, if I might, to that, which is the main challenge that we're facing is that people are believing that we have to live with this virus. It's very hard for people to think that the restrictions will be persistent over a long time. So the main challenge is to communicate and to have a strategy where there is an exit from the current situation. And this requires understanding that the main exit is through geographic contraction. So we have to be able, there are places in India still today where there are very few cases. So we have to be able to protect them and declare and show that they can sustain elimination in those areas. And that will enable the contraction of the areas that continue to have the disease. So people have to have the hope that there's an end to this. Otherwise, it's very hard to convince them to do these restrictions because they appear to be perpetual. And that becomes very difficult for people to imagine.
Right. Thank you. That's a great point. Yeah, I think that hope is something that we really need. So, yeah.
Thank you,
Vidya, do you want to add anything? Vidya, do you want to add anything?
No, I just echo both Dr. Raina's and Professor Yaneer's words. And I think ET has interviewed our founder. We had a series of questions were asked about finance and economy, where restricting each zone, that inter-transmission between the districts, interstate transmission, that has been rapidly boosted out since the first wave, where we were in a position, because India is a country where we meet, greet, celebrate, and keep on roaming around very, very freely, 24/7. It is not restricted at all. So we just go to the next neighbor district to buy some commodity which is much cheaper. We go to the neighbor city where it is more some sort of quality oriented. So we have a diverse way of thinking, and our political views are different. Even political parties are much different from what the citizens think. As Dr. Raina was mentioning, central government is different, state governments are different. Each values of each government governance is totally different. So in that sort of confusion state, having a principled way of living and sort of moving around is very, very essential. That adds to control the fast spread of the virus for sure.
It's a personal responsibility, right? Right. Yeah.
Absolutely, ma'am.
Yeah.
Thank you.
Okay.
Thank you, Anjali from the Economic Times. Thanks for coming and joining us today. If you need further information, you can email me. I sent you my email address in the chat.
Thank you.
Thank you.
Yeah.
All right, moving on. So we haven't had any questions yet about testing, but there was a question here from Murdy about testing. What is the reason for the number of tests dropping? Is it a deliberate direction from the authorities to delay testing, or is it a lack of test kits? Oh,
Please.
Does anyone have any information on that?
There are two ways to answer this question. Now, if we look at what we have been doing since the beginning, at some point in time when we started in 2020, we had one lab which was testing RT-PCR. Now, at this point in time, we have around 3,000 labs doing RT-PCR. But the problem is that the days or the time taken for one report to come out in the public domain or to an individual who has submitted his test is 2 to 3 days. So if you submit your sample today, the chances that you will receive the report day after tomorrow. So around 48 to 72 hours is the time lag between submitting a sample and getting it reported. So the advantage of early testing is lost if you have such a huge lag between submitting a sample and getting the report. So in that adversity, I would not advise people to go for testing at a huge level or increase the testing. I would say we should stick with the strategy that we had been using. Strategic testing will be the key. Unless and until we are able to hugely ramp up our testing facilities, we're able to double our testing facility, get to 3 times our testing facility in a day's time. Now, the problem with that is that if I'm increasing the testing, where do I get these tests done? So I will have to open up my entire private sector to do these tests. And the cost of doing these tests in private sector is on the higher side. At this point in time, most places, whether it's in the government sector does it free of cost, but the private sector is also doing it at a very low cost. So if I'm opening up more centers, people will talk of the rise in prices, rise in cost of taking a test. So that is something government is averse at this point in time. So that's why they are still going with that concept of strategic testing. That's one part of it. Second part of it is if I double the testing and say, for example, if I'm reporting around 4.5 lakh today, and if my testing will take it to around 6 lakh, 7 lakh, that's what people say. Increase the testing, you will find more number of people. So what do we do? What do I do with that number? Do I have the facilities at this point in time to isolate everybody? So if I have the facilities to, at this point in time, to isolate everybody, identify all contacts, put them under quarantine, I should increase testing and let it go the way that it can go. So that's why I'm at this point in time very averse to making it 2 times or 3 times the number of tests that are required to be done. We still need to do strategic testing at this point in time.
And eventually the statement is the following: if we get the cases down by a factor of 10, we will have enough testing. So what we need to do is to get the cases down by a factor of 10. And that's the imperative in order to solve the problem. Yes?
Thank you.
All right.
So we are coming to the hour here. We have a lot of folks that have joined us. We have a lot of interest in helping, and we are hoping to continue the conversation here. End Coronavirus hosts many calls and collaborative project efforts for ending COVID across the world, and we are hoping to get some volunteers that are interested in helping India. And I know that all of you here are interested in doing so. So I am going to drop the link to join our virtual office space on Slack here. I'm also going to put my email address if you have any trouble joining Slack, but we plan to form a weekly meeting for Indian efforts. So I really hope that we all can stay in touch. There's been questions regarding writing a petition. I don't know if there's any petitions that any of the callers or the speakers are aware of, but if they are, please drop those in the chat. There was also a question about local entities that can distribute large amount of free high efficiency masks from one of our longtime volunteers, Rami. So if so, please email him at mail@ppehotline.com. And I really appreciate everyone's time, and I hope to see you in future calls. This is just the beginning of us helping India. This conversation was to bring everyone together. So please do email me and sign up for our virtual office on Slack. And let's get together again. We are looking for local organizers, group leaders, all different types of people with all different types of skills are needed. So please don't count yourself out just because you don't have letters in front or back of your name, okay? We need everyone to help together. Would anyone here like to say some final words before we depart for today?
Why don't we give each of us a chance? Vidya, would you like to start?
Well, More and more prayers are needed for India now, and precautions, restrictions, and preparedness must be the key, I believe. And from Project Step 1, I personally request all the medical fraternity across globe to help Project Step 1 to heal Indian citizens with more and more teleconsultation. We are facilitating for overseas teleconsultations also in lieu with the government rules and regulations. I request everyone here to help Project Step 1 to strengthen ourselves to reach more COVID-19 affected citizens. Thank you all.
Sunil.
I think we need to realize that the approach to this pandemic has to be global. You can't have a segregate approach or a in silos approach that one country will deal it to the other country will deal it differently. All of us need to think together. Maybe our actions can be local, but the broader aspects have to be global. So that's one part of it. The second part of it is that we all need to stay patient, and we all need to stay hopeful, and we all need to put in those same efforts in the same direction, that we need to end it and not just think about that. We will sit back and wait for the second wave, wait for the third wave, and then the virus itself will get fatigued out and it will leave the planet Earth. It's not going to happen. We all need to stay focused and think of ending it, chasing it out. If we don't think of chasing it out, we won't win this battle. That's the key. And India is critical to the global efforts as far as driving out this pandemic is concerned. If India is not able to drive it, it's not going to dry out of the world as such. It has to be, India has to drive it so that the world is able to drive it.
Thank you. Let me just say that right now there is indeed a perspective that what India needs is oxygen, ventilators, and medical facilities. Please do not think that if you don't have access to those, that you cannot help. Most of the work that needs to be done is information, communication, and support through engagement of teams in figuring out ways to intervene that can be done often remotely, that can be done through contacts and understanding of the way information is being shared with others. Because ultimately, the actions that need to be taken are actions that have to do with people understanding what needs to be done and coordinating actions that influence the conditions now or the conditions that will be present in a week or 2 weeks or 3 weeks or longer from now. So everybody can participate in this process. We, of course, welcome everyone on this call and your friends and colleagues to participate in what we're doing, because that's how we achieve what Sunil has talked about, which is to chase this virus from India and from the world. And thank you, Vidya, for describing the work of Project Step 1, which has, across this time of the pandemic, indeed served India through providing the right kind of information, even though it's being done remotely, to help people, whether they're sick or whether they need the information about how not to become sick. They've been doing a tremendous job. And of course, Sunil, who has been spending a tremendous amount of effort and time to communicate how the strategic actions are able to stop this pandemic. Thank you both. And Katie, if you would like to close, I think we are at a good place for that.
All right. Thank you so much, everyone, for taking time out of your busy schedules to join us. We will keep it positive. We will keep up the hope, and we will work together. We are definitely stronger together when we bring our voices and efforts together. So please join us at endcoronavirus.org. If you have any trouble with that link, you can just simply email me at katie@nexi.edu and we will get you networked. There was a question about helping Brazil as well, because as we know, our friends in Brazil are also having a really hard time. And we do have calls for Brazil, so please attend our call on Mondays for that. So thank you so much, everyone, for coming. and have a wonderful day. I will leave the Zoom on for a little while so people can grab links and scan the chat for their needs. Have a wonderful day. Thank you.
Thank you.
Thank you.